Hello, Mr. Castle. My name is Rachel. I'm a nurse practitioner student with Youngstown State University, and I'll be performing your health history assessment today. First, I need to verify some information. Can you tell me your name and date of birth?
Mike Castle, 110294.
Okay. And how do you want me to address you today?
Mike's fine.
Okay. So what brings you in?
Just a general checkup.
Okay. Overall, how are you feeling?
Pretty good.
Any concerns?
No concerns. No, not at the moment.
Okay. So today I'm just going to be doing a health history exam, so I'm basically just going to ask you some questions about your health history and immediate family members. So let's start with your parents. Are they both living?
Yes.
How old is your dad?
63.
And does he have any health issues that you're aware of?
Yes, he has type 2 diabetes. And he, I don't know if it's epilepsy or not, but I know he takes medication for seizures, so there's that chance that it's happening. He hasn't had one in a while though, but I know that is an issue.
Okay.
I think that's it.
Okay. And how about your mom? How old is she?
62.
And any health concerns with her?
I think just that she's on medication for high cholesterol, maybe high blood pressure too.
Okay.
But other than that, no real concerns that I'm aware of.
Okay. Do you have any siblings?
I have a few siblings, yes.
Okay. Do you have brothers, sisters?
I have one older sister, one older brother, and a younger brother.
Okay. How about your older brother? Any health concerns with him?
No, not that I'm aware of.
Okay. And how about your younger brother?
No issues.
Okay. And then how about your sister?
I know she has epilepsy. I know she takes medication for it. She hasn't had a seizure in a while, but she does stay on the medication for it.
All right. And then how about your grandparents? Are any of them still alive?
One of 4.
Okay. Is it on your mom's side or your dad's side?
It's my dad's mom.
Okay. Let's start with her. So, do you know how old she is?
Mid-80s, 85 maybe?
And any health concerns that you're aware of?
Maybe, I don't know if she's been diagnosed, but onset dementia.
Mm-hmm.
She's getting older, so she just, forgets things. She's kind of immobile. A lot of things she does has to be assisted, so just physically weak, but other than that, no huge concerns. I don't think she's really.
Does she live on her own? Or?
She lives in an assisted facility.
Okay, so she needs help with her daily activities and
Correct.
all that. Okay.
Yeah.
How about your dad's dad? Any health concerns with him?
Yeah, when he passed away, he had dementia and Alzheimer's. I believe he also, before that, led up with type 2 diabetes as well. He passed away in his 70s.
Okay. How about your mom's side? How about your mom's grandfather or your mom's dad?
Yeah, he had some heart issues. He had open heart surgery in his 50s. I think he had a heart attack at some point, probably before that, which led up to it. But that was the main health concern he had. But he lived to 98.
Okay. And how about your mom's mom?
Also some heart issues. She had a heart attack, some heart surgery. In her 60s or 70s, she passed away. But I think that was from cancer.
Okay.
Lung cancer.
Lung cancer. Okay. Okay. Focusing on you more. Where do you live?
7 Hills.
Do you live in a home or apartment?
Oh, a house.
Okay. And what's your highest level of education?
I have a college degree, bachelor's degree.
Okay. Are you currently employed?
Yes.
Where do you work?
I work at Nestle Stouffer's. I'm a supply chain analyst over there.
Okay. And about how many hours a week do you work?
40 to 50.
Okay. Any allergies to medication, food?
No food. I was told I'm allergic to penicillin. I had a reaction when I was a little baby. So that's kind of what we've just been saying, that I'm allergic to it. I haven't had it since, so I don't know if there still will be a reaction or what type of reaction or how bad the reaction is.
Okay. Do you take any medications currently?
No.
Okay. Are you up to date on any vaccines?
Yeah, the childhood ones. I'm up to date with those. I get my flu vaccine.
Okay.
That's about it.
Any past surgeries that you've had?
No surgeries.
Do you drink caffeine?
Yeah, I drink some.
About how much a day?
3 cups of coffee, 300 milligrams maybe.
Okay. Do you drink any alcohol?
A little bit.
About how much a week?
Like 1 drink a week.
Do you smoke at all?
No.
Do you use any illicit drugs?
No.
Do you exercise?
Yes.
About how much a week?
Probably like 10 hours.
Okay. And you said you lived in a home in Seven Hills. Who do you live with?
My wife and my son.
How old's your son?
18 months.
Okay. So now I'm going to go over some of the systems of the body. Let me know if you have any concerns in any areas or want to focus more on those. Have you had any fever, weight changes, fatigue?
No, not anything out of the ordinary.
Okay. Any headaches?
Nope.
Okay. Any difficulty swallowing?
Not as of recently, no.
Okay, good. Any issues with your teeth?
Nope.
Do you go to the dentist regularly?
Twice a year.
Okay. Any vision or hearing changes that you've noticed?
Nope.
Do you get yearly eye exams?
No. No issues with the vision, but
Okay. Any issues with your nose? Any nasal congestion, stuffiness?
no. The occasional cold, but that's about it.
Okay. Going to your lungs, any issues breathing? Do you ever feel any chest tightness, coughing?
Not as of recently, no.
Okay. Any chest pain, palpitations that you've noticed?
Nothing out of the ordinary.
No swelling?
Nope.
Okay. Any abdominal pain, distension or bloating?
Nope. Nothing out of the ordinary.
Okay. Any constipation or diarrhea?
Nope. All good.
Do you ever notice any black or bloody stools?
No.
Okay.
Nothing bad.
Okay. Any difficulty urinating?
Nope.
Do you ever feel like you have to get up in the middle of the night with an urgency?
No, not an urgency, no.
Okay. Any issues getting or maintaining an erection?
No.
Okay. Have you noticed any skin discoloration?
No. No issues.
Any new or changing moles?
No.
Any rashes, itching?
No, not really. No.
Any joint pain or muscle pain?
No, I've been pretty good.
Any muscle injuries that you've had? No strains or sprains?
No, not really. I got like a golfer's elbow, so my elbow gets a little tight sometimes. But that might just be from weight training.
Does it go away on its own after a couple of days?
Yeah, and it really, unless I do a strenuous activity, then it doesn't really bother me.
Okay, but nothing long-standing?
No.
It goes away?
Yeah.
Okay. Any history of seizures? I know you said your dad and your sister have a history.
Correct.
Anything with you?
Not with me.
Okay. Ever feel lightheaded?
Not often, no.
Okay. Not often, have you in the past?
Not really that I can recall.
Okay. Any numbness or tingling?
No.
Okay. Any issues with excessive bruising or bleeding that you've noticed?
Nope, no issues.
Okay. Any history of blood clots?
No.
Okay.
No.
Have you ever had a blood transfusion?
No.
Okay. Any feelings of anxiety?
No.
Depression?
No.
Ever had any thoughts of harming yourself or suicide?
Nope.
Okay. Any difficulty sleeping at night?
No, not really.
Okay.
No.
How's your family support at home?
Good.
When you're feeling stressed or anxious, what ways do you cope or manage your stress?
Mostly just kind of hang out with the family.
Mm-hmm.
Kind of just relax. Just play around with the little one.
Okay.
That kind of release some stress.
If you ever go through hard times, who is the person or people that you can go to?
My wife. And I'd say my mom.
Okay.
My wife and my mom.
Good.
Those are 2 go-tos.
What brings you joy in your life?
My family.
Anything in your life that you find difficult or troubling?
No, not really.
Okay. You feel safe at home?
Yeah.
Okay. Is there anything else you would like to talk about today?
No, I don't think so. No, generally I'm feeling pretty good.
Okay. Well, that's all the questions I have for you today. If you have any questions or concerns, you can contact the office. But I'll see you next time for your physical assessment.
Thank you.